So this work is with Bongo Ki, professor of sociology at Kookmin University, who's also on here. But all the mistakes are mine. Just kidding, I won't throw him under the bus. So let's see, here we go. Okay, so care support ratios are meant to be a simple method to evaluate how demographic change may impact care economies. So in looking at market-based economies, support ratios get used a lot to talk about demographic dividends, things like that. So this is just a way to bring the care economy into that kind of framework, and also most especially include the unpaid care work part of the care economy, which is so often overlooked. So the method has three parts. The first is estimating age profiles of some type of care. And we have the age profiles are of production and consumption. So production is what we're usually focusing on when people talk about the care economy, but we also have an imputation so that we can see who in the economy, by whatever characteristic, is consuming the care that gets produced. So because we want this to be a gender aware method, we can separate this out by sex or any other characteristic that is important to the care economy. So in other work, we've separated these age profiles out by socioeconomic status to see how the care economy functions differently depending on SES. The units I'm going to show today are all in terms of time, but as most of this group knows, you can impute a wage to unpaid care activities and put everything in monetary terms as well. So the second part you need to produce these ratios is some scenario of future change. So what I'll be showing today is a future change in the population provided by population projections to show what population aging is going to affect the care economy. Or this scenario could be in the care economy itself, so how the age profiles are going to change, or like we saw in the previous two papers, if there is a scenario of policy change and an interaction between the two. Although that adds a great deal of complexity, and one of the things I like about this method is how straightforward it is. So when you have the age profiles in a scenario of the future, you combine those two to estimate the aggregate production and consumption and take the ratio to give you the care support ratio. So we usually put the production on the top of the ratio so that we get a sort of average production available to support the consumption that we project will be demanded in the future. So here are two age profiles of parts of the care economy. So this is focusing on just unpaid care work. So that includes direct care activities, but also indirect care. So direct care of children, elders, community members, but also indirect care provided through housework, household maintenance, and management. The heavy solid lines are for Korea. The dotted lines are for US. So this comes from the American and Korean time use surveys, and this is looking at 2014. So what we see here is the general pattern we would expect of women doing quite a bit more unpaid care work. There's sort of a double hump shape here. The most intense production age groups are in the childbearing years of the 30s. And then there's sort of another hump here that's associated partly with retirement. As you do less paid work, you shift towards more unpaid care work for yourself and your household. And then also grandparents provide a lot of care in both of these societies. So then over here is the consumption side. So how do we get that? In our time use surveys, we have the full household roster in both of these surveys. So I know from the time use survey how much care work is being produced in that household. And then I have numerical methods to impute who in the household by age and sex is consuming that time. So we see that the most unpaid care work is produced in households with the youngest people. So these numeric methods give high household or unpaid care work consumptions to infants, and then very low as you enter adulthood, and then increases again in older persons, although more so in the US than in Korea. So we've talked a bit, a few people have mentioned the issue of secondary or activities or supervisory care. So this for the US, so these are both just US here, shows between the dotted lines, which were shown in the US slides previously, and then the solid lines, how much more care you get when you include the supervisory care of kids and also for elders. So that's in the American Time Use Survey, asking if you were also caring for children age 0 to 12, or if you were caring for elders because of a condition related to aging. So for some age groups, this almost doubles the total amount of care time. So it takes a 40-hour-a-week job on average for women in those peak child-rearing years and turns it into about a 70 or so hours per week. So that's a lot of additional time. And of course, this frame also doesn't include times like when your, say, infant would be asleep and you still have to be there, but it's not considered that secondary activity. So maybe an understatement in some ways. And so how does that secondary care or supervisory care flow through to the consumption estimates? Well, you can see here that most of that secondary care is for children. So it increases the estimates for infants from about almost 60 hours a week to almost 120 hours a week that they're consuming. And of course that overlaps. There could be two people caring at the same time, but we are adding those up for kids. And then there's some increase at older ages, but not as much, or much less. And I should say that sort of one of the reasons, at least in my brief association with time use research, that we don't have good incorporation of secondary or supervisory activities is that it's done so differently in different time use surveys. So I think we would get a lot more sort of buy-in across the time use research world in including this if we would agree on one best way or maybe two best ways to do it, and then got more harmonization across our survey instruments. So here we're going to move on to the paid care work economy. So we want to look at the care economy in a completely holistic way, combining all types of care, paid or unpaid, all age groups, children and elders. And so this is sort of a first stab at the paid care work side. Now, this is just sort of, the non-professional groups. And so how do we get these data? So for the US, it was the current population survey, and for the census, or for Korea, it was from the census. And there are occupation codes for people who are asked what they do. And so those occupations are coded up, and also asked how much time they spend in the labor force. So obviously we have some difference in the occupation codes from the US versus Korea, because in the US, these non-professional occupations, and what it's meant to be are childcare workers, home health aides, workers at adult daycare centers, things like that, and also housekeepers. And so people who are providing those services, but probably didn't have to get a ton of extra education. They most likely had some credentials or qualifications they had to meet, but it wasn't sort of years of medical school and things like that. So in the US, we see, of course, a big gender gap in who's doing this kind of work. It's overwhelmingly women. Same thing in Korea, but the reason that we probably need to go back and work on our occupational codes is that in the US, these occupations are being done by women at pretty much all the ages in the labor force, whereas in Korea, it's very centered on women who are in their late 50s. So, and men are doing this in Korea almost not at all. And you'll notice too that this is hours per week. So this is averaged across the whole population. So on average across all the population, you get a low hours per week. And now how do we do the consumption imputation? So I know how much time workers are spending in these occupations, who is consuming that time. So here I use the Consumer Expenditure Survey in the US and to get how much households are paying for these kinds of services. So how much are households paying for childcare, home health aides, things like that, both out of pocket and insurance or supported by public sources. And so I don't have the same thing in Korea yet, but we're working on that. So I just used the US shape for the Korean data to be able to move forward. So kids are consuming most of these hours. As for older persons, there's an increase, but it's not huge. And so that just reflects really how much time is being produced in these different occupations. So childcare versus, say, home health aides or adult daycare workers. Now, these are paid care work production and consumption also, but of those more professionalized occupations. So this includes teachers at all levels, and then medical care providers, so doctors, nurses, and other kinds of medical care providers who would be directly providing services, and also social workers. So those folks had to have gone to school for a long time, and they're much more intensive sort of credential requirements and things like that. So that's why we put them in a different group. And here we see that between the US and Korea, so again, Korea is the thick lines, and the US is the dotted lines. So these, the time that workers are spending in these types of occupations looks much more similar across the two countries. Although, and again, we see that women are doing a lot more of this stuff than men. The interesting thing to me here is the tilt to younger ages in the Korean data. That could be a cohort effect. So these cohorts sort of moved into these occupations more strongly than their mothers had. And so maybe this shape will change over time as those cohorts age. Now, how to get the consumption imputation. So I know this looks a little messy, but that's because of some smoothing issues with education. So to impute who is actually consuming the time that these folks are producing, I use the National Transfer Accounts age profile. So that NTA project takes market activities and national accounts and disaggregates those by age. So for doctors and nurses and other medical care providers, this includes how much people by age are consuming of all those services, and that's whether it's paid out of pocket or by insurance companies or by publicly provided or underwritten insurance. And then for education, same thing. So that's how much people by age are consuming of education across all types of payers and providers, so public or private. And we do those in separate sectors. So education is separate from the healthcare, and then combine them to get this overall imputation. So given the hours that I see produced over here, they are being consumed by younger people in terms of education, but then a lot of the healthcare hours are being consumed by older persons who are consuming a lot more healthcare. So what is the future demographic change that I want to pair with my current snapshot of the care economy? So as other presenters discussed, Korea is a rapidly aging population. The US is aging now as well. Both populations have below replacement fertility. This wasn't true in the US for a long time, but now is. And so these bars are showing the proportion of population over time. So from 2020 in the light gray, all the way up to 2050 in the black. So we expect in both societies that there will be fewer young people over time and far more in the 80 plus group. And then, so will have an older society, and that process is more rapid in Korea than the US, but that the US is facing similar. So here are the care support ratios themselves. And so what the care support ratios do is take all of those age profiles totting around back here, and then use population projections over time to get an aggregate estimate of the consumption over here, and then the production over here, and then the consumption over here, and compare those in a ratio over time. So, and across the bottom, the bars that show the relative change in those support ratios compared to 2020 have just sort of different types of different sort of slices of the care economy. So for unpaid care work over here in Korea, we see that relative to 2020, in 2030, this bar is actually higher. So why is that? Well, part of population aging, while it does sort of move people out of the peak productivity ages in terms of both producing unpaid care and paid care and market work, and is that you have fewer very time expensive children. So this support ratio goes up a little bit, which is the analysis telling us that the shape of demographic change in this small time window is actually making it easier to provide the current levels of care that my care economy is giving out to people. Now, I should say, to preface that rhetorically, that sort of makes it seem like right now is just fine. And I am looking at whether we will still be just fine in 10, 20, 30 years. So that's certainly something I don't want to say, because we know that certainly from other work we've heard about today, that there's a lot of not just fine at all. There's a lot of people who are expressing the opinions in these survey instruments that they were providing a lot more unpaid care or other kinds of care than they would like to. So while numerically it sort of assumes that 2020 is fine, I should say that's not what I'm trying to say here. It's just saying whether population change from 2020 is going to make it harder or easier to do things as we're doing them today. And so over the next couple of time slices, population aging continues, and our care economy in Korea on the unpaid care work side is going to have a harder time providing the levels of care to people that those consumption age profiles implied. So I don't have my supervisory care here for Korea, but over in the US, looking at the difference between the unpaid care work impacts over time versus when I include the supervisory care, they're not much different. And that's because the age nature of that supervisory care, at least in terms of the producers, just sort of shifts the production up. Everybody's doing this supervisory care. So in terms of the aging implications, when I think about supervisory care, they're not very large. Now, this paid care work for the non-professional sectors over time has a much bigger challenge from population aging. And then when I look at the professional care workers, that's even bigger. So, and then we see the same relative patterns in the US, although the challenges are much less. And that's mostly because the US pace of aging is slower. Now, let's see, sorry, just reviewing what else I wanted to say. So this is a pretty simple demonstration, but I think at least it shows the idea that age profiles and care support ratios are powerful, flexible tools for measuring and understanding care economies. Now, we could have taken those age profiles and looked at them in many different ways. As I mentioned, socioeconomic status is one of the big sort of additional characteristics that we'd like to chop these analyses up into, because in terms of policy messages, that's going to be probably the most salient in trying to address these shortfalls and problems. So which groups are having the problems? Because if you are not focusing on that, you could design a policy that solves the problem for a group that doesn't really have it. So that's what I wanted to demonstrate today. And I know it was sort of a whirlwind and I left a lot of the details out, but we can talk about those as we go along. So thanks very much.
Great. Thanks so much, Gretchen.